I'm Brooke Lovelace, the Executive Director of the Iowa Developmental Disabilities Council. Just a couple of housekeeping things. There should be an interpreter pinned for you that you can also use closed captioning by hitting the More button down on the bottom to get the closed captioning started. And we will be doing questions, and you can put those in the chat, and then when we have time, we can have people come off mute too and ask their questions live. So with that, I think we'll go ahead and get started, and I'll turn it over to Amy.
Yep, I got a quick section section this week, and Carlin's going to talk more about the home project since that is coming up here in a next week comment period. But if you want to go to the next slide, Emily, I just wanted to give a quick review of a few of the bills that have moved since our last meeting. I'm not going to go into detail, but I put the bill tracker link in the chat, and then it's also here at the end of the page. Just a reminder that if you want a bill to stay alive and continue on the process of the legislative process, the bill needs to be out of its first committee. So the committee it was first assigned to by Friday, February 20th. So it's really Thursday the 19th because they don't work Fridays, but we have about 2 weeks now to get bills out of committee. So a lot of subcommittee action, a lot of committee action. Just a couple things. The first step in doing this is passing subcommittee. So you'll see a few bills have indeed passed out of subcommittee, including one that we're really a bit concerned about, and Carlin's been watching closely, which is House File 2003, which creates a pilot program that actually allows a school district to separate special education kids and other kids that have serious behavioral issues into a separate school, which of course we feel is against federal law for equal school opportunities and integration. Also noting that the regular rate review for Medicaid rate review for home and community-based services providers passed out of subcommittee yesterday. They are one of the only Medicaid providers that doesn't have some form of regular rate review. So this is considered a really important piece to making sure those providers have enough money to provide the services and to retain staff. I wanted to update you on two that were just introduced this week. Senate Study Bill 3052, which creates, kind of legalizes, puts a structure allowing driverless cars. I know some people with disabilities have been watching this issue as a way to provide better transportation in communities for those who are unable to drive due to their disability or just prefer not to drive. So that passed out of subcommittee. I believe there's a House bill now, but I didn't find that bill number yet for you. The one that came out today I wanted to introduce, make sure you knew about, was House File 2306. And that creates some new responsibilities for educators and staff, so teachers, staff that are working with kids and students who have an IEP or a 504 plan. I know Carlin hasn't reviewed it yet because it was introduced about an hour ago. And it basically says that the teachers have to read the plan and review it, and there's some other things in it. It looks pretty good on the surface, but again, I only reviewed it really quickly. So wanted to give you a heads up on that. If you are interested in that, you might want to take a look at it. So Carlin, I'm going to turn it over to you, and Emily, if you want to advance the slide.
Hi, everybody.
Oh,
Thanks for
sorry.
joining us.
I forgot about this one update.
I thought you were
Yeah,
gonna let
I'll
me
have
do
this in there. Sorry, guys. I just a quick update, and Carlin can add to this before she goes on to the next section. But I was told by Representative Austin Harris that he has a Medicaid reform bill coming, not Medicaid reform, public assistance and welfare reform bill, which is what he called it, coming out next week. And there will be some good things in it. I'm sure there will be some things that will concern people because it's putting changes in for the work requirements as required by federal law and how the state plans to implement that. So we'll probably have some concerning pieces to that, but they are going to include and the Medicaid for Employed Persons with Disabilities program. In that, an expansion, it will not go as far as what probably people want with work without worry, but they are going to work on what they can to try to get this moving forward and opening up that program more. So I'm not sure exactly what it's going to include, but I've heard it will be introduced next week. So watch the bill tracker, and we will get that in within 24 hours of it being introduced. We'll also put it on Facebook or send out an alert when that's introduced. Sorry, Carlin, now it's your turn.
Oh, thanks. Well, welcome everybody. I'm Carlin Crow with the Iowa DD Council, and we thought we would share some information today about the home project because the public comment period for changes to the new waiver system are due next Friday, by the end of the day. And so we have a week to review, if you haven't started yet, many, many, many pages of documents that are on HHS website under Home Project. You can get lost in this section if you click too much. And I think while I'm talking, hopefully we can put the links to what we're talking about in the chat so you can easily get there and um, see what we're talking about. Everything that's on our slides today is also on the website. We just condensed it so we can give you an overview of what's going on and mostly information about making public comment because it's very important for Iowa HHS to hear your thoughts, your concerns, what you might like about it, or also if you're unclear about what the changes are going to be, they need to hear that. So we'll talk about that a little bit later after we review what home is. So home has been around for a few years now already. The acronym popped up a couple years ago after they started a review of basically the home and community-based system or the waiver services system for Iowa. And since they're going to make changes to the waivers, then Iowa HHS has to submit their own waiver to the Centers for Medicaid and Medicare in the federal government under HHS and get approval for these changes. So the public comment period and the documents that are being reviewed are actually their waivers that they have very, they're quite detailed and quite comprehensive. And I'm sure it was a load of work. And you can see it all because they have them made public for everybody to read and make comment. And it's a great thing, but it makes it a little bit challenging to get through it all and really understand what's going on. So if you haven't yet, give yourself some time to look there and see what's going on with all the changes. So, and if you haven't heard yet, the changes are going to be kind of significant. So there are many waivers right now under the current system. They're going to be whittled down to 3. And the idea is to, instead of basing your waiver eligibility on a diagnosis, it's going to be based on the level of need of the person on the waiver. So there will be a easier menu of services to follow. We hope the idea is that it's supposed to be easier, and there won't be, hopefully, there will be less confusion about which, there won't be really choice when you are, right now, people have to decide which waiver works best for them. And I know that creates a lot of confusion when applying to be on a waiver, and they all have different waiting lists. So now they're based on age. So you apply for the waiver either if you're um, under a children and youth waiver for that age group, or adults with disabilities waiver is the second one. And then the third one is the elderly waiver, and that's already in effect right now. So it'll be the same and it won't be changing. So those are the three that they're combining the current seven. Is it seven or eight? I always get, because it's always whether we're counting habilitation too, which is also not changing. So I think you can go to the next slide. I know there's a lot of text on these slides, and I don't want to read them, but again, just to give you an overview of what's going on and also what's on their site. And also what's on the home project site are some easy guides that they've put together about each of the waivers that are just a couple pages long. But then their waiver that they're submitting to CMS is the one that's more complicated to read. So eligibility is, not much different from what the current waivers are as far as disability. And waiver slots, or how many people will be on the waivers, is, um, something that we all have been keeping an eye on because, obviously there's still waiting lists, there's still going to be waiting lists. But the change in the idea is that people will hopefully get the services they need more quickly if there's urgency, and hopefully fewer people will be waiting years, 5, 6 years to get on the waivers that they need, and perhaps can get services that will help them um, um, take care of needs in the meantime before they can get a whole waiver slot. So the capacity is listed there as far as how many participants, whether it's children, and again, there is a limitation as to how many people will be on the waiver. However, what we've heard and what their HHS is projecting is there's not a cap on services. So it's an array of services that each a waiver will have. The caps might be more on how many units of services are available for the, again, based on the need. So that is the detail that we're still trying to dig through also. And some of that has not been determined yet. I think if you go to the next slide, yeah, the timeline here helps give us a little bit better, maybe not understanding, but when things will go into effect. So phase one is starting soon. I think they're shooting for midsummer, where every waiver except for brain injury and the ID, intellectual disability waiver, will move to either children and youth or adults with disabilities. The ID and brain waivers, brain injury waivers, will wait until phase two. So for somebody on either of those waivers, nothing will change in the current year, not until 2027. So 2027, when the BI and ID waivers are rolled out and everybody transitions, we'll have a better idea of what we're talking about when we're talking about services, and what the limitations might be in units of service that's available. They have said that, public comment may make a difference, and also what CMS approves or does not approve. So there's some things that are yet to be determined, and that I know gives some of us anxiety, but that's where you can chime in and make your comment. So next slide. Oh, Amy, you put a lot of slides together here, girl. So let's see. News services. Yeah, it's a good thing. Oh gosh, my screen just messed up. New transition services. Yes, peer mentoring is new. That's something that we've had groups who have advocating for more peer mentoring, and so that will be added. More access to pre-vocational and supported employment that was not available on previous waivers will now be available to the adults with disabilities waiver. And I think both because it's through transition. So that's a good thing also where we don't have to worry about which waiver you're on in order to get voc rehab and also supported employment. So what's going to be eliminated? Again, these are based on some changes in both policy, rule, and clarification of what would you say? Maybe calling them something different than they currently are. So in-home family therapy is out. Um, skilled, unskilled attendant care is not going to be in the children's waiver, but it will still be available. It's these are the little technical things that, again, we're all trying to work through and understand. Nursing, home health, and medical monitoring and treatment. So things that used to, again, be under um, waiver specifically for children are still going to be available, but through a different part of Medicaid. And again, I know this is confusing, but this is where you work with your case manager on how that change is going to be made. So don't panic. Most of these things will still be available, but the way that they will be available are going to change. Some things that are set to be eliminated. Um, let's see. So the what's different is budgeting again. So it's based on need, not diagnosis. That's not coming until phase 2 as far as individualized budgeting. So everyone will have their list of services that are available with some additional services if needed. And that's how budgeting will be set. So um, hopefully it will help make things more consistent for um, for people on waivers, and also, so you're not having to worry after every assessment that's done how things are going to change. I know that's part of what the plan is to make things easier and more helpful for people. So as we go through these, we should have said this earlier, because we're not the experts on all of this. We're just trying to give you the high level overview. I don't know that we can take a lot of questions today about what the specifics are on a lot of them. We have talked to Iowa HHS about providing more specifics, and they are really want people to read the documents online, their waivers, their overviews, and comment there. So I think if you go on, we're getting to the public comment information section. Next slide, please. So here's the quick guides that I mentioned. So much of what was listed on the slides are in the quick guides. And this is the page that has all of the information that you can dig through to comment on. And next slide.
Yeah, Carlin, I was going to say, if people are confused, I was confused reading the waiver documents because most of the information is in the appendices, appendices.
Appendices.
And so I started to try to read it and summarize it, and then I found the guides, and I'm like, why didn't I just look at the guides to begin with? They're much easier to read, and they are in plain language. So I would start with them and then move to the waiver documents if you want to. But all of it, the guides that are on here are really helpful in breaking down what it is. even if you still have questions when it comes to that, and I think that's the next slide we're going to, those are the things you need to put in your comments. So,
Right. And that's when I read the quick guides, I was concerned that they weren't more detailed. So then I started digging through the documents themselves and trying to find things in the appendices, which they give you guides for which ones to look through that have the most information. And that's again, it takes a while to dig through all of it and find what you're looking for. So the quick guides are good. They just may not give you some of the details you might be looking for. And again, if you don't find it or you have questions or it doesn't seem like you're getting a good understanding of what the changes really are, that's what you need to tell what you need to make in your comments. We've heard that from a lot of people that they're very difficult to read through, and they may not be as specific enough to your situation, and put that in the comments. So that's they are required to HHS is required to give 30 days for public comments. Actually, they extended it a little bit because of the holidays being right before now. So the deadline is next Friday at midnight or right before. And actually, the way that they're receiving the comments are it's not a form online. You have to send them to a specific email address. So the address is on the on the website, so you can click right on it. Don't try and retype it in because that can cause errors. But it gives you directions on who it's emailed to, or you can send it through snail mail also to Iowa HHS's address, which is included on there too.
it's on the next
Um,
slide too. Emily advances it.
it's on the next slide. Anyone can give feedback, and if you gave your feedback already and then you thought of something else, give more feedback. They can't have any more. They're all feedback is good. Let's just say it that way.
Yeah, there's
So
no limit to how many emails you can send or written comments you could send. So if you think of something after you've already sent it, go ahead and just send another email.
So yeah, as we said, suggest changes, point out problems, highlight things that look good or what you again might have concern about. Be as clear as you can and specific. Giving specific that should be everybody's best advice. Be as specific as possible to your situation and why the changes are concerning or good or what you might like to see more of.
The next
And
slide has more information on what's next. And I think one of the things that people are always asked is, what do they do with those comments? They actually do summarize the comments and the feedback that they get when they submit to HHS. So they have to say, this is what we heard and this is how we changed it based on what we heard, because there will also be more, they'll consider those comments when they look at whether to approve it or not.
great. I think we can go on. So we are considering some ways to help people make comment or ways that you might be able to talk with people who are in your situation and talk through things that you want to see or not see. And one thing that's coming up that could be helpful is event at the Capitol on February 9th, where several groups have gotten together to um, talk about the home project, not only the home project, but why Medicaid is important to Iowans and what it means to people, and to protect the supports and services that it provides to people with disabilities in Iowa. So it's being called an education day, a rally sort of, but it's not a protest, just a way to gather together at the Capitol and talk about what's important to you and have people help you get information and have people help you talk to your legislator. So the gathering is at 3:30 on February 9th. This is Monday. It's coming up quickly. But if you come earlier, if you come at 1, other advocates will be there to help you talk to your legislator. And so we have a session coming up right after this about how to do your messaging if you're interested in that. And then also people will be there to help you find where you make public comment on the home project, talk about the home project a little bit, and help you submit your comments if you're interested in doing that. So it's a great opportunity. So it's mostly all of Monday afternoon. If you're interested, there's a website that we'll put up that you can, or a Facebook group you can put up where you can get more information and kind of sign up and get messages about it. And thanks to those organizations that put it together, the Common Coalition, the Brain Injury Association, and the ARC. And we'll be there helping to support people to talk to your legislators. Next slide. We're getting close on time here. We'll open up for questions. So yeah, if you want to get some help on how to talk to your legislators, we're doing mini trainings every Friday if folks are interested. Right after today, it's right after Capitol Chat. Next Friday, it'll be at 12:30. So through the whole legislative session, you can drop in and talk about everything from again, which door you go in to get into the Capitol, or what should you say to your legislator? How do you call them out? Those sort of things. So it's a non-judgmental, non-intimidating environment. You can ask any question you want, and we'll try and give you advice and also help you with your messaging. Next slide. I think we're getting close to the end.
I think that's the end.
That's the end.
Yeah, so 3 minutes to spare. It's hard to get through these in a half an hour, but the first funnel deadline we already talked about. So anybody have other questions? I think you see in the chat that Brooke had mentioned that Disability Rights Iowa is trying to summarize their concerns with the home project. So if they prepare those in advance, we will get those out to those that want it. Hopefully Disability Rights Iowa would publicize their concerns, but if people want it, I think if they email Carlin, they will. Brooke said they will. So we'll try to get those out publicly too. Any other questions in the last 2 minutes?
Quiet group today.
They're all thinking about what they're going to say on the comments.
It's a lot of information.
All right. Well, I guess we will wrap it up for today. We'll see you in 2 weeks. We'll send out our weekly report on Monday. We'll have a new bill of the week on the Medicare rate review for home and community-based services providers up on the website this weekend. Thank you, McKenna, our intern who's been writing these. So if you like the bills of the week, that's McKenna online, our Drake student who has been doing those for us. So thank you to her, and hopefully she'll join us on these.
Yes, thank you.
All right. Thanks, everyone. Have a great weekend.
Thanks, everyone.
Bye.